Hello, my name is Dr. Richard Fleming, and today is the 4th of August, 2020. We've entered our 8th month of COVID-19. 2 days ago, I asked for a moratorium on PCR testing and asked that it be limited only to hospitals and doctors' offices. Merely having nasal or oral swabs looking for COVID-19 does nobody any good, with the exception of those who just simply like to add up numbers. The focus shouldn't be on numbers, the focus should be on patient care. To do that means a doctor has to take a look at you and make a decision about whether you look like you need treatment or whether you simply look like somebody who could have COVID and you're asymptomatic. Controlling the cost of resources and personnel and using it for its best purpose for treating people and saving lives is really where we should be focusing, not just collecting a bunch of numbers for those who are narcissistically looking to have that information. Today, I'm calling on a new moratorium. This one more alarming and more concerning. A moratorium on the use of COVID vaccines. At first blush, this may seem contradictory to what you've been listening to for the past few months, and it should, because for the past few months, you have been told over and over and over again that the only way that this planet will be safe from COVID-19 is to vaccinate as many people as we can. They've abandoned the concept of finding treatments for people that are severely ill and focused on the approach of let's vaccinate everybody as many times as we need to. If the influenza vaccine has taught us anything, we can expect this to occur at least once a year, although the reports looking at the antibody titers don't even show that much promise. The question is, why should we be vaccinating people for COVID-19? And if your response is so they don't get infected, that's not what vaccines do. They don't prevent infections. They predispose you and give you infections so that you supposedly will build up antibodies, which we now know is probably not going to happen, at least not for more than a couple months. In 1994, 1995, 1999, 2000, and 2002, and 2004, I talked about inflammation and blood vessel disease ad nauseum. This explanation included what happens when we get viral infections to people that already have inflammatory diseases in their body. Obesity, the elderly, high blood pressure, strokes, diabetes, you name it, cancer. And the immune naive, the very young, the people that haven't been exposed to anything yet and they don't have a well-tuned, well-regulated immunologic system. We seem to vaccinate them anyway. The vast majority of people are going to do fine when they get exposed to COVID-19. They're going to have a viral infection. They're not going to feel good. Some people don't notice anything, but many people have some type of symptoms and they don't feel good. That is a common reaction. The problem is the people that are dying with COVID-19, the people with these comorbidities. They're going to talk about vaccinating everybody. And for the people that are simply going to have a run-of-the-mill viral infection, I ask you, what is the real benefit of vaccinating these people? It's not herd immunity, because they're going to get herd immunity by simply getting exposed to it naturally. The problem is going to be vaccinating everybody, the very young who are the immune naive, and those with the comorbidities. These people take very little additional spark of their immune system to not only attack the virus, but to attack their body where they already have health problems. Heart disease, strokes, cancer, diabetes, high blood pressure, the elderly. Who are they really trying to protect here? They tell you not to take and go out and get within 6 feet of people and to wear a mask so that you don't spread COVID-19 from one person to another. Specifically, they don't want you giving it to the little child who maybe has leukemia, is undergoing chemotherapy, or the lady down the street who's undergoing treatment for breast cancer, because you will kill them. Don't spread the virus to them. And yet, that's exactly what the vaccine's going to do. It's going to spread the virus intentionally to these people. If it doesn't make any sense for you to be around these people because you might spread the virus to them naturally, does it somehow make more sense to give these people the virus intentionally? They're going to have the same immunologic reaction, the same flaming up, inflammation, and blood clotting that's already killed hundreds of thousands of people. Either the argument is valid, don't spread the virus to other people, or the argument isn't valid. You can't have it both ways. Vaccinating everybody is not only going to expose people who will do well with the virus naturally, it's going to expose people who are predisposed to having these blood clots and inflammation as a result of their immune response reacting to the virus, because that's what we're trying to elicit with the vaccine, an immune response. It's time to stop the nonsense. It's time to quit doing this backwards. It's time to approach it scientifically. There should be a moratorium on these vaccines. I don't know why the rush, but I do know that they've done a good job of scaring and frightening people into it. They've done a good job of guilt tripping you into not getting around everybody else and isolating yourself from other individuals. It is completely illogical to be vaccinating everybody with a virus that you claim there's no treatment for and giving it to people that have already demonstrated they will die from the inflammation and blood clots when they're exposed to this virus and their immune response kicks in. It's time to stop the nonsense, and I'm calling for a moratorium on what's happening with the vaccines and a focus towards allowing doctors to treat patients the way that they see fit, treating people who are symptomatic earlier, and treating them for these blood clots and inflammation when they get hospitalized and doing it correctly. It's the 4th of August, 2020. Haven't we already lost enough people?